Histoplasma capsulatum. It is a dimorphic fungus that causes histoplasmosis, which is a systemic granulomatous disease. At around 25 degrees Celsius outside the body, it exists in the mold or filamentous form. But at around 37 degrees Celsius inside the human body, it changes into the yeast form. That is why it is called as dimorphic fungus. A physician named Samuel Tyler Darling described this disease. So, histoplasmosis is also known as Darling's disease. Let us move to the pathogenesis. It is particularly associated with soil enriched with bird or bat excreta. When this contaminated soil gets disturbed, for example during construction, excavation, demolition, or cleaning areas contaminated with bird or bat droppings, the fungal spores can become airborne. When a person inhales these spores, they reach the lungs. And this is where the pathogenesis of histoplasmosis begins. The inhaled microconidia reach the alveoli where they are engulfed by alveolar macrophages. They transform into yeast form. We know that normally macrophages are supposed to destroy microorganisms, but histoplasma can survive and multiply inside the macrophages, particularly within phagolysosome. Hence, Histoplasma capsulatum is the intracellular yeast inside macrophages. Histoplasma then travels to the lymph nodes and can spread to other body parts through bloodstream. In most of the immunocompetent individuals, meaning those with normal healthy functioning immune system, a strong cell-mediated immune response develops. This usually controls the infection. Immune cells gather around the infected area and form a granuloma. The granuloma therefore acts like a wall around the infection, preventing the fungus from spreading easily. If the immune system successfully controls the infection, the granuloma can gradually heal. During healing, the area may undergo fibrosis, forming scar-like fibrous tissue, and may also develop calcification due to calcium deposition. But in people with severe immunosuppression, such as in HIV infection, the cell-mediated immunity is severely impaired. So histoplasma can escape control and cause disseminated histoplasmosis. Histoplasmosis can present in three major forms: pulmonary, mucocutaneous, and disseminated. The most common form is pulmonary histoplasmosis. It is usually a flu-like illness. Patients may develop fever, cough, fatigue, etc. Chest X-ray shows pulmonary infiltrates and sometimes hilar or mediastinal lymphadenopathy. Chronic pulmonary histoplasmosis may occur particularly in people with underlying structural lung disease, especially smokers. Mucocutaneous histoplasmosis involves the skin and mucous membrane producing lesions. It is usually seen as a manifestation of disseminated histoplasmosis. We have already discussed that disseminated histoplasmosis occurs mainly when cell-mediated immunity is severely compromised. Moving to laboratory diagnosis, the specimens include sputum, blood, bone marrow aspirate, etc. Histopathological staining shows tiny oval yeast cells. Culture is an important method for identification. At approximately 25 degrees Celsius, histoplasma grows in its mold or mycelial form. We can see microconidia and the characteristic tuberculate macroconidia. At 37 degrees Celsius, it converts to the yeast form, which are creamy white colonies. This temperature-dependent conversion is called dermal dimorphism. Skin test may be done to demonstrate delay-type hypersensitivity response to histoplasmin antigen. Antibodies can also be detected using serological methods. Molecular tests like PCR can help detect histoplasmin DNA. Treatment depends on the severity of the disease. Liposomal amphotericin B is commonly used. And that wraps up a high yield overview of Histoplasma capsulatum.